disorders are serious mental illnesses, and they can come up and appear in many different ways. So most often people have this skeletal idea of what an eating disorder is, but actually in reality there are so many different types. So anorexia nervosa is one of the many that perhaps we often associate with that term eating disorder, which is often characterized by the intense fear of weight gain, by body dissatisfaction, as well as restrictive eating. So really severely restricting how much someone is eating in a day. Other forms of eating disorders may be bulimia nervosa, which includes restriction of eating as well, combined with coping mechanisms such as binge purging, right? So that may look like eating substantial amounts of food in a very short period of time, and then followed by purging behaviors, which may be use of diuretics, of laxatives, and or self-induced vomiting. And then another type is also binge eating disorder, which is actually the most common type of eating disorder that, is actually something that isn't necessarily brought up for many people. People don't necessarily think of them as eating disorders in the general public, which is why they may not seek support. And what that may look like is someone perhaps using binges as a coping strategy. And they may eat a very substantial amount of food in a short period of time, and this is typically going to happen at least once per week for a series of 3 months. Another category of eating disorders is actually eating disorders otherwise specified. So these are going to be eating disorders that don't necessarily they kind of pull from the different diagnoses, which can include symptoms from anorexia, from binge eating, from bulimia as well. And one of those in that category can actually be orthorexia, which is, it's almost like a diet gone bad, right? So it's an extreme form of obsession about clean eating and eating only healthy foods. So this may mean restricting any foods with added sugars in them, with any kind of saturated fats, trans fats, and it's this extreme fear of those types of foods and putting those in our bodies. If you're unsure whether you have an eating disorder or not, ultimately at the end of the day, it comes down to whether you're feeling distress around eating. If the eating experience is lending to intense feelings of anxiety or fear, or you're kind of trying to avoid it or using compensatory mechanisms relate after eating or before eating, perhaps thinking that food has to be a reward for or as a consequence of doing severe, extreme exercise, or maybe that you must exercise extremely after a meal. If any of those types of thoughts, cognitions, feelings come up, then there is perhaps something there, then absolutely it is worth seeking support. Oftentimes, we may feel at one with our eating disorder, with an eating disorder. And what's really helpful to conceptualize the eating disorder and start understanding and starting the recovery process is seeing, your authentic self as separate from the eating disorder. And so there is often actually a technique that we use that is from acceptance commitment therapy, which is ACT, also known as, and it's this process of what we call diffusion, right? Which is creating space between you and your thoughts. And so the eating disorder voice, we can call it, often is really, really loud. It's very, very strong, especially when you're in the midst of it and you feel like there's no way out, right? And it can be really, really tough. And so what we want to try to do is start turning down that volume, and how we can start doing that is by actually looking at it from an objective observer's perspective and thinking about, actually, this is my eating disorder speaking, not myself. This is not my authentic voice. This is not what I want. This is actually what the eating disorder wants. And starting to distinguish that can be a really, really helpful place to start. So what we often see in people living with an eating disorder is lower self-esteem. And this also coincides really closely to having low self-compassion, right? This sense of, dislike towards themselves. Maybe perhaps they feel unworthy and non-deserving to eat or to be loved and to be cared for. And so that makes it really difficult for someone with an eating disorder to actually care for themselves. One of the nicest places to start is thinking about how you would treat your best friend, right? Is how would you treat a puppy on the street? Oftentimes it'd be really, really nice. And so we have to think about, actually, how can I bring back that kindness and that compassion all the way back to myself? Because at the end of the day, it is a human right. It is your birthright to be cared for, and you are worthy in and of itself. There is no question about it. It's so important to know that wherever you are in your journey, recovery is possible. If you are ready and you want it, and you're determined that you want to live a life without your eating disorder, it is absolutely possible. In terms of where to get started, the journey will look different for every single person, but it's important to start thinking about, what is it that you want your life to look like? What could it look like for you without your eating disorder? Once you start this visualization process, it can actually start opening different resources that you may have available to you. So seeking support, being surrounded by people who want the best for you will be so, so important. Maybe even cleaning up your social media feed will be an important step that you can start taking, filling it up with empowering messages, people who have themselves recovered from an eating disorder, people who are body positive, spreading awareness about this. There isn't one size fits all approach and mentality to life. That would be a really great place to start. Some really, really great practical tips to start moving away from your eating disorder as that main coping strategy is thinking about perhaps journaling. Journaling is one of the kind of go-tos, gold standards in recovery, is really writing down what it is that you're going through. So emotions, and trying to reframe those emotions, right? So those thoughts, rather. So if you have a really, really recurring thought that is really unhelpful, that is damaging, that is causing distress, what I would encourage you to do is write that down and then think about 3 ways that you can actually reframe that thought from a different perspective. So you can imagine perhaps what a friend would tell you, what a fly on the wall would be observing, and how they would perhaps see the situation. So it can be really, really difficult at first, but it's certainly so effective to start really changing the cognitions and neural pathways, because we often have the same thoughts over and over and over again. And so this exercise is really, really great to start moving away from that really well-established thought pattern. Another one will be being able to start identifying your emotions. So labeling your emotions, what you're feeling, where you're feeling it in your body. And then actually, once you label that emotion, trying to move away from, again, the food as that coping strategy, and actually think about, what is it that I actually need if I'm feeling this emotion? Right? So whatever that may look like, it may be different for every single person. But if I'm feeling anxious, maybe I need to go outside for, a little walk, a brisk walk for, with maybe a loved one. Maybe I need to go pet my dog. Maybe I need to literally just have a sit and read a juicy novel. So what is it that you actually need? Another coping strategy may be yoga, gentle yoga, meditation. These mindfulness practices have actually been shown in the literature to support recovery and actually help improve body image and self-esteem and embodiment. So a big part of eating disorder recovery is coming back home to your body, is reestablishing a more positive relationship with that lived experience in the body. Another coping strategy that could be really great to get started is calling a friend, seeking support. So if you need that support, if you're feeling isolated, alone, that is how eating disorders thrive. So certainly do seek support. We have, the Be Well Collective, you have Beat Charity, the Seed Charity UK, Anorexia Bulimia. So there are loads of services out there that are there to support you. So please don't be afraid.